Do you want to win in the ever-changing competitive field of healthcare management? First of all, you've got to get in the game. You've got to use analytics. The path from merely providing care to expertly managing health begins with accumulating the best data on your patients and your practices. This means acquiring a cross-section of data from your claims, clinical, socio-demographic, and care management sources. The goal is to decrease costs, while at the same time increasing your patient population's health. Not an easy task, because approximately 3/4 of all Americans are dissatisfied with the escalating fees for their health care. Do you realize that more than $100 billion is lost every year to unnecessary costs? But your patients can influence more than half of those wasted dollars. What you need is something that allows you to efficiently gather clean, validated data from all your sources, to provide patterns and make more accurate predictions of your patient population's health needs. This data will help you focus on the patients and conditions that have the most potential for cost savings and improvements in the quality of care you provide. Gathering the big data is possible because of the vast amounts of claims, clinical, and other data generated through your practice. Claims data, which is produced within your billing system, provides a holistic view of each patient's interaction with the healthcare system. It is an excellent source for compiling the cost of care. Your electronic medical records furnish a wide range of facts and figures that aren't included on claim forms. This clinical information spans every event within your care continuum. This lets you know how medicine is actually practiced within your organization. The Internet provides just one source for non-traditional data on socio-demographic and care management. Use it to round out your big data. But you know the old saying about data, garbage in, well, you get the idea. Much of your big data is just that, a large amount of unstructured numbers. Only about 20% of EMR data is marked, labeled, or tagged so that it can be identified and acted upon. To turn big data into best data, it must be cleaned before using. Best data is validated, normalized, and extracted. Only then will it become a powerful tool to help you create a true picture of your patients and practice. Imagine being able to identify your at-risk patients earlier and possibly preventing high-cost events. Not only does this preserve your patient's health, it reduces expenses. That's the outcome everyone is searching for. Utilizing analytics allows you to get a clear understanding of how your physicians are performing and identify any gaps in care. So if your goal is to manage the health of your patients and the efficient practice, get in the game by utilizing the full capabilities of analytics.